Hello and welcome to the EuroHealth podcast. My name is Jiří Svoboda and our guest today is Dr. Judit Bidló, Hungarian Deputy State Secretary for the Professional Management of Health. Doctor, welcome and thank you very much for your time.
Thank you very much and good morning to everyone.
So our topics today will mostly revolve around the fact that Hungary is currently holding the European Council presidency, and that is for the second half of 2024. And one of the priorities of Hungarian presidency is also health, and more specifically cardiovascular diseases and organ transplantations. But I wanted to start more on a let's say personal or general level. Given that you work for the Ministry of Interior, what exactly is the role of the ministry and specifically setting up the presidency? How does the process really work?
Well, in the Hungarian governing system, there is a huge ministry. This is the Ministry of Interior, and healthcare belongs to this ministry since 2 years ago now. And I think it's a very successful cooperation together with the education and together with other interior things as well. During the presidency, of course, there is a high-level agenda for Hungary that we would like to reach during our presidency. The most important thing is to increase the competitiveness of the European region, to increase the competitiveness Hungary as well as part of the European region, because the economic aspects now says that there is a need for focusing on the competitiveness. And within that, as a healthcare priority, we would like to focus on, as you mentioned already, on the cardiovascular diseases and the transplantation. Mm-hmm. The reason we chose these two topics is that cardiovascular disease is still a major cause of death around the world and in Europe as well. And that's the area where we could gain the most healthy life in the healthcare system. That's why we are focusing on that.
Well, and we will get to that in much more detail, of course, in the forthcoming questions. And let me just start with one more question at the general level more. So how much can a country, do you think, can influence in half a year of a presidency? In your case, even more with the fact that it's kind of split in half with the summer holidays and not much is happening during the summer months, of course. How much Hungary wishes to achieve in the short amount of time?
Well, actually, I would challenge it a little bit because we have an extremely tough July because we really kicked off July as a presidency. We have lots of high-level discussion and conferences already, so only the August was rather on about the vacation. I think the role of a presidential country is to summarize and coordinate the different opinion on different subjects. Of course, we have some dossiers which we would like to continue and make and reach conclusion in some part of the currently ongoing dossiers, to continue what the trio already has started on that. We had to really collect all the information, all the standpoint from the different countries' perspective. We would like to somehow harmonize it and make recommendation on that. When we initiate a new topic, as it happened with the cardiovascular diseases, it's rather about the thing that we would like to focus on a certain therapeutic area, which we would like to raise the awareness that this is a new topic. And based on, we are quite ambitious on them, so we would like to reach council conclusion by the end of December, so by the end of our presidency, on cardiovascular diseases, which means that the European Union is unified on the issue that this is a very important thing. We somehow have to handle it and create action plans that we would like to achieve in the near future.
So, of course, Europe is currently in the age where we have to care about a lot of other issues than healthcare. It's a security. We have migration. We have a lot of other issues to care about. How hard was it to push and have the agenda points related to healthcare in the program? I imagine it must be a struggle to even push the health agendas on.
Well, I don't think it's really a push. It was rather a need. when we had a preliminary discussion before the presidency that we would like to raise this cardiovascular issue, there was a uniform agreement on that. We had the full support of the WHO as well. So it was really a successful story to choose, because everyone sees that now this is the field we should move on, rather instead of the oncology, rather we would like to focus now on the cardiovascular diseases.
That's really interesting that you say instead of oncology. Why is nowadays the cardiovascular diseases for you or for the Hungarian presidency, and I imagine for lots of other people as well, why is it bigger priority than oncology at this point?
I wouldn't say it's a bigger priority, but I think the last couple of years and decades was only about the oncology. Everyone was focusing on the oncology, since there were new therapies available and there were new mindsets available in the oncology. But I think now we are at the point we have to sustain the oncology healthcare system as it is now. But there is a huge need for improvement in cardiovascular diseases. Approximately 3 times more patients die every year because of cardiovascular diseases than oncology diseases. And we do not focus enough on the prevention and the holistic approach of the cardiovascular diseases. And this is why we think that we should focus on that now.
Yeah, it's a third of all that's in the EU related to cardiovascular diseases altogether, which of course it's a lot. Since you work in the Ministry of Interior and the Hungarian level, let's maybe stop with one question about how does the Hungarian situation look like in the cardiovascular disease treatment? How is Hungary doing in this regard?
Concerning the medication and the pharmaceutical, we are in a very top level of worldwide, so every medication is available in Hungary. I think the need for further development is especially in the prevention and those risk factors which can define the cardiovascular performance of a certain country. There is a lot to do on that. We are not in a very good position concerning the risk factors which can have an influence on the development of different cardiovascular diseases. So we would like to focus on that to avoid this risk factor and its influence on the cardiovascular population.
Yes, cardiovascular diseases are one of those which can be very much influenced by healthy or unhealthy lifestyle. For instance, consumption of alcohol or tobacco. What kind of policies does Hungary want to promote in regards to lessening the impact of tobacco and alcohol, perhaps lessening the consumption of these substances, hence also reducing the amount of people with cardiovascular diseases?
In my opinion, in Hungary, the most important risk factor was in the last decades is tobacco. It's not rather alcohol, but rather the tobacco, because not just only the cardiovascular diseases and not just the cardiovascular impact, but as well as lung cancer impact. So there is a clear link between the consumption of tobacco and the lung cancer. That's why the government decided approximately 10 years ago to initiate a program, which means that we control the consumption of tobacco. It's available only just certain dedicated shops. Tobacco, you cannot buy any kind of tobacco. We have a close cooperation on this issue with WHO. I think on the classical way of cigarettes and so on, we could reach huge improvement. Of course, we have to tackle now the new challenges that come in this is the e-cigarettes and other tobacco-containing uses of drugs. So that's what we would like to move now. But as a classical way of consuming tobacco, for example, the cigarettes, I think we are in a very good position by controlling the the market of the by controlling the tobacco market.
So the measures you're mentioning is really are on the side of the supply, controlling the market, right, and controlling the supply of tobacco. Some countries choose to maybe focus on more of an educational side of things, trying to get smokers to start smoking with less harmful alternatives like e-cigarettes or basically alternatives to classical cigarettes that are in the end less harmful to them, versus the very restrictive approach. So there are different ways to tackle this. Where does Hungary stand between the, let's say, very restrictive approach and very educational and on the European level sometimes called harm reduction approach? Where does Hungary stand in this spectrum?
I think there are tons of scientific debates whether tobacco itself as cigarette is worth to tackle, or rather the whole tobacco industry, so rather the e-cigarettes as well has the same effect as the classical cigarette. So there are huge debates on that. We think that, as fully agree, as you mentioned, that there is a huge role to start the clarification and start the discussion with the younger people, with the youngest people, if it is possible. That's why we initiated a new program. So as of September, in the school there will be lessons on how we can prevent different diseases in the youngster. What is the lifestyle we should follow, and make the awareness of young people how they can participate and how they can have a healthy life through their life.
You're mentioning children now. I read that the program of the Hungarian Presidency and the Council also says that it wants to put the emphasis, quote, on the cardiovascular health from childhood through old age. So is also Hungarian Presidency going to focus on the not only on the younger generations, but also on possible smokers which already smoked for 10, 20, 30 years?
Concerning the cardiovascular diseases, so it's not about just the smoking habits and the tobacco consumption, but on the cardiovascular diseases, that's what is very important, that we would like to focus on a holistic approach. So from birth until death, there should be a continuous following and follow-up for those people then have a risk on cardiovascular risk factor. That's why we initiated new kind of screening programs, which has a result that can be defined whether is there a risk factor for a certain patient and how many is the chance to have cardiovascular diseases. Additionally and parallelly to that, we redefine we redefine the Hungarian primary healthcare system. We would like to focus on the screening, the cardiovascular screening, so not just the classical oncology screening, but the cardiovascular screening within the primary care system. We would like to initiate public health program, which can help for those people as well who has already some risk factors and who has already some cardiovascular diseases.
Let's more move to the European level now. Of course, the cardiovascular diseases, as we already mentioned, affect people from all member states of the EU, but all have different demographics, different healthcare systems. So what do you think can be accomplished in terms of harmonizing the approach to cardiovascular diseases within the barriers of Hungarian presidency within that half a year? What do you wish to achieve in terms of harmonizing the approaches within the member states?
When I'm talking about the harmonization of the different approaches, rather on the dossiers that are currently ongoing and there are huge debates. For example, we are responsible for the global pharma legislation, which is an extremely hot issue and hot topic for all the countries, and there are different approach, different way to handle this issue. That's where the presidency has a clear role to harmonize the different aspects. In the cardiovascular field and in this kind of professional fields together, and the transplantation as well, we are rather more unified opinion from we have rather more unified opinion from the different aspects. We have a full support of the European Cardiovascular Association, so we have really unified agreement that this is very important, and we have to tackle especially the prevention, the primary and secondary prevention, and that is what we need to act.
Mm-hmm. Mm-hmm. Can you elaborate more on how were the prevention programs going to look like on the European level, or harmonized between the countries?
I think, in my opinion, if there is a common understanding that this is very important, and make a council conclusion, what is the key priorities of a prevention program and how it should be look like, it means that there should be some financial support as well from the European Union. That's why we would like to reach a council conclusion, because there are good programs, there are good pilots already in the different countries. We collect all these best practices. We would like to share all these kind of best practices, and if there is a common understanding, then it will be really a conclusion, and we can go forward on that.
Do you think the European Union, more specifically European Commission perhaps, allocate enough funds, because you just mentioned the financial side of things, do they allocate enough funds for the preventive measures as opposed to maybe more conventional treatments of the cardiovascular diseases?
I think it's not their role to allocate money for conventional treatment for cardiovascular diseases, but there are discussions how they can force prevention program, how they can force healthy life program and healthy life status program. They are all participated in our meeting. We already have a high-level conference in July, in the 4th of July, with the participation of the European Commission, and they were quite engaged to support our programs. Of course, the details has to be discussed. That's what we will do during the autumn, and after that it will be clarified what is the way of supporting financially or in other way these kind of programs.
Okay. The Hungarian presidency also plans to adopt the European Action Plan as like one of the key initiatives on the European level about cardiovascular diseases. What kind of policies does Hungary want to promote in this action plan? What will be the content of it?
Naturally, as based on the white paper we submitted to all the countries, the most important factor is, as I mentioned, that to have a whole approach, a holistic approach. So the action plan will contains measures on the prevention, on the primary prevention, the secondary prevention, the treatment as well, and what is still important for the rehabilitation as well. So there will be different recommendations for the different levels of handling the cardiovascular diseases.
Mm-hmm. Mm-hmm. What is the next step after this document is drafted and it's approved? What are the next steps to actually make these things happen? Which I think everybody would agree they are very important.
I think the way it will be that there will be some discussions on that. There will be finalizing of this issue and the topics itself. And we do hope that by the end of December, when there will be the formal EPSCO meeting, which is the ministerial meeting of the ministers responsible for healthcare, there should be adopted a council conclusion about this issue, which means that it creates room for certain action. So when there is this kind of action plan will contain only high-level recommendations, and we should try to work it and manage it in a lower level and in an operating level.
So the council conclusions kind of paves way to also maybe other following presidencies to also take care about this issue and include it in their programs. Are there any discussions already with the following presidencies going on?
We have lots of discussion with the Polish people and the Polish Health Ministry, and they are quite engaged to continue this project. They are fully agree on that. They will start a new trio, as well. We are the last part of the trio now, but they will start a new trio. But the Polish colleagues, during our discussion, emphasized that they are fully support this initiative and they would like to continue that.
Let's talk about the second health priority of the Hungarian presidency, which, as I said, is organs donations. So it seems to be, of course, there are so many healthcare priorities out there that could be improved and could be tackled. Why did the Hungarian presidency choose organ transplantation in particular?
Organ donation and transplantation has been raised by the Croatian presidency, but unfortunately they were the president during the COVID, so it was not the time when they could really manage this issue. And we choose it to continue and again hanging it up because in my understanding it is very important as well. There is an association, it is called Eurotransplant, but only 8 to 9 countries join this Eurotransplant cooperation, and there is a need to the other countries somehow to unify the process, the possibilities, and to share practices between each other. This is much more important that in a practical way, as in an everyday life, how they can manage the organ donation itself, both legally and both in the surgical way. So it is much more important here to share the practices and find good solutions rather than have an official council conclusion of that issue. So we would like to give room for this development. We would like to give room for this scientific exchange to the different countries. We also have a high-level conference on the 11th of July. It was also a big success because every country emphasized that there are those issues have been tackled that was not mentioned in the past couple of years. And there are huge differences between the countries how they manage the organ donation and transplantation. For example, the Spanish, who were before us in the trio as well, the Spanish government is very successful. So they give us some highlights how they can reach it, how they can have the engagement of the people, that this is a very important issue.
Exactly, as you mentioned, topics of this high-level discussion recognized the importance of cross-border cooperation, reducing inequalities between member states, end quote. So there, I imagine there must be huge differences between all the member states in how they tackle the organ donations. So do you wish to also harmonize more and synchronize more, like share the experiences?
In this meaning, I think our major goal is to have a common understanding and knows each other best practices. So we do not want to have a council conclusion on that and make exact recommendation because there are so huge differences between the country aspect. But maybe if they can have a good idea on what to do and how to increase the awareness of organ donation, what to do legally, how to regulate this whole issue, that can help a lot to the member states.
Because ultimately, I think the goal is to have more organ donors available at the European level. Because I understood there is a persistent lack of the organ donations altogether, right? That there is a shortage.
Yes, exactly. There is a shortage in every country, but there are more good performing country and less good performing country, and it was very interesting, the discussion, how they could realize that what they can do, what is the idea that some countries initiated, and how it works in the real life. So it was extremely useful for every country.
So how does Hungary do in this regard? How is the Hungarian situation in the area of organ transplant? What do you wish to bring to the European table from your expertise?
Hungary is part of the Eurotransplant, so we are one of the 8 to 9 countries who joined the Eurotransplant. And I think, of course, in the COVID period, every country has less performance on organ donation and transplantation. But after that, we could reach finally the level of the organ donation as it was previously to the COVID thing. We are, as in an average phase, we are not the best performing, but I think we are in a good performing countries. We have lots of educational program to let the hospitals know what to do if there is a possibility for the donation, and to make as smooth pathway to this process as it is possible.
Let me also stop with another health-related issue, which is more of a topic, not so much of the Hungarian presidency, but yours, because I understood you were part of several initiatives that concerned mental health, the Hungarian presidency also in the program recognizes the link between mental health and various other emergencies. So what exactly are the links here, just to get a bit more broader understanding of the mental health, maybe to other health emergencies that we are currently dealing with?
When we are talking about the 21st century's challenges, we should not be able not to reach mental health issue. And as you mentioned, there are extremely lots of aspects of that. We are all aware that there are problems with the young people, there are problems with the elder people. The COVID also rephased the problems and the symptoms on different mental health issues. Together with the WHO, we choose from this basket mental health and climate change, because there are, and how it has an impact to each other, and how has climate change can impact the mental health issue. It seems to be that there is a triple crisis to attack, so not just the climate change, but the water and the air pollution as well. I think there is a more and more need to make something, or at least to define something on this issue. So concerning mental health, we would rather focus on the definition, or to identify the problems that can be caused by, for example, climate change, and what are the symptoms that can be defined as mental health problem.
When you talk with WHO, when you talk with European legislators from other countries or the European level, is there a common understanding that the mental health actually is linked to issues like climate change, issues like air pollution? Because it's not an easy link to make, I imagine. Mental health sometimes is considered just mental health.
Yes, exactly, but the World Mental Health Day is year by year much more bigger initiative, and there are a lot of new aspects that is defined concerning the mental health. There was how COVID linked to mental health, and how those things that happen during the COVID can influence our mental status and mental health, we have different discussion with the WHO, and that's why we choose just to make the awareness or open a new way of interpreting mental health, as how we can, that there should be, or there is a possibility in the effect of the climate change to the mental health as well. That's why it's really just just an information and really just a new definition on that, and not really again a concrete action plan.
And in Hungary specifically, if with this kind of knowledge and this, let's say, more progressive approach, what kind of new policies or programs you are doing in Hungary to tackle these novel issues in the mental health area?
In the mental health area, again, I think there is a huge need for definition. There are Hungarian scientists just published a new definition code and a new definition process in mental health. It was just published a couple of days ago. So I think it is an issue here in Hungary. There is not in the mindset that mental health can cause so severe problems that as with other symptoms and other disease area. So we would like to draw the attention, to take care on that, and be aware that this could be a problem. And as a possible reason, it's not Hungary specific, quite frankly speaking, to have the connection between the climate change and mental health, but it's rather a European problem. It is a huge problem in the Nordic countries as well. So that's really, I think there is a need for rethinking and reshaping our definitions concerning mental health.
What do you think is the biggest priority now, moving away from the Hungarian level to the more European level? As you said, it's a problem for all the member states. What do you think is the way to cooperation, is the way to more harmonization of the tackling of the mental health issues together? What are the next steps in this regard?
I think that there will be some specific conferences tackling that, and there is no white paper on that. This issue, there is discussion, but aspects should be further should be a subject of further investigations, and what should be really checked on that. So there will be another conferences in October in Brussels, and there will be some scientific committee meeting, and during that meeting we will define the next steps.
Dr. Judit Bidló, Hungarian Deputy State Secretary for the Professional Management of Health. Doctor, thanks a lot and best of luck with the rest of the presidency.
Thank you very much, and thank you very much for the possibility.